Hi, everyone. Thank you for joining us for another episode of STEM Girls Virtual. My name is Emily, and I'm here on behalf of Cincinnati Museum Center. On this show, we talk about different careers in the STEM fields, those fields being science, technology, engineering, and math. Today, we have Beth Rezelj, a nurse with Medtronic. Beth, thank you for joining us today.
Oh, thanks for having me, Emily.
Yes, thank you. So first off, some people may not be familiar of the company you work for. So can you tell us a little bit about Medtronic and what they do?
Sure, I'd love to. So Medtronic is one of the largest medical device companies in the world. So I'm very fortunate to work for Medtronic. But our therapies help 72 million people a year. And those therapies also support Medtronic's mission, which is to alleviate pain, restore health, and then extend life. And so some of those products include pacemakers, cranial and spinal robotics, patient monitoring systems, surgical tools, and also insulin pumps, which is a part of the diabetes group. And that's the group within Medtronic that I work for.
Awesome. Yes. And so today's episode, we talk about Medtronic, but we're specifically talking about insulin pumps and diabetes management. So if you're interested in learning more about Medtronic, we'll include the link to their website in the event description. So talking of diabetes, a lot of people have heard of diabetes, but they may not be aware that there's different types of diabetes, primarily type 1 and type 2. Can you tell us what those diabetes are and how they're different?
Sure. So, and that's a great point, Emily. We hear the word, diabetes a lot, but we don't necessarily make the distinction between type 1 and type 2. So patients living with type 1 diabetes, since that's an autoimmune disease where the body turns against itself, and in this case, it turns against the pancreas. So the pancreas stops making insulin. And so patients living with type 1 diabetes, they have to take insulin in another way, whether it's through injections or through an insulin pump. But then type 2, on the other hand, so basically their pancreases still produce insulin, but their bodies just can't regulate the insulin that it's making. And so a lot of times their treatment is a combination of several things, whether it's lifestyle and diet and exercise, it can be certain medications, and then also insulin itself.
Okay, and you've mentioned insulin. Some people may not be aware what insulin is and what it does to help the body.
Yeah, so insulin's a natural hormone that is made by the pancreas. The reason insulin's so important is because it helps to regulate the amount of glucose that's in the blood. Because whether we're diabetic or not, we all need insulin to help regulate our blood sugars. And so that's what goes wrong with diabetes, is the pancreas either doesn't make it any longer, or the body isn't able to regulate the insulin that it is producing.
Okay, and so you're a nurse by trade. Can you tell us how you became interested in this field that you're working in now?
Sure. So diabetes is something very near and dear to my heart. My mother was a type 1 diabetic. And so growing up, diabetes was all my sister and I ever knew. We just thought that was the norm. And we watched her struggle with that disease her entire life until she passed away 10 years ago, this month actually. And so after that happened, I realized it was unnecessary. It could have been prevented. So I decided to kind of change my focus, and I transitioned from cardiology to diabetes. And I've been with Medtronic for about 9.5 years now, and I haven't looked back since. I thoroughly enjoy what I do.
Well, thank you for telling us that personal story. So speaking of Medtronic a little bit further, they make medical devices that can help you manage your diabetes. Can you tell us what those devices are?
Sure. So Medtronic designs and manufactures diabetes technology, including insulin pumps and continuous glucose monitors. Sometimes you'll hear them called CGMs for short, because it's a mouthful.
Yeah.
But an insulin pump is just a small device that mimics some of the ways
It's an
That's
insulin
an
pump.
insulin pump that mimics some of the ways that the healthy pancreas works. So what it does is it actually delivers a continuous drip of a rapid acting insulin 24/7. And then it also customizes doses based on that person's body's needs. And then with a continuous glucose monitor, or that CGM, it's so cool. It takes a glucose reading every 5 minutes, 288 readings in one day. I like to call it the EKG of our blood sugars. So it helps patients living with diabetes to monitor their glucose in real time, or they're able to look at their glucose over a period of time. And so CGMs can be worn by themselves, or they can also be worn with an insulin pump.
Mm-hmm. Yeah, as you just saw, everyone, I am a type 1 diabetic and use an insulin pump and a CGM. And that's how Beth and I got connected. She's my nurse at Medtronic. So I begged her to be on the show. But I've been an insulin pump wearer for almost 20 years. And I just have to say that the technology has improved so much. And again, people hear 20 years, but like that's a really short amount of time for technology to improve as much as it did. So can you tell us a little bit about how that technology has improved?
Yeah, so to say that diabetes technology has really improved is an understatement. And thank goodness, right? It really has been incredible to see how diabetes technology has evolved over time. When we look at even just how we measure glucose, to the different types of insulin, to how those types of insulin are administered themselves. It's really just amazing to see how far it's come, which is wonderful because it has enabled millions of people living with diabetes to really gain better control over that disease. And in particular with insulin pumps, they have not always been automated. And so, patients had to basically rely solely on finger sticks in order to manage their diabetes. They spent so much time being reactive to blood sugars. Now with the CGM technology, the automated pumps, patients can spend more time being proactive and staying ahead of the disease.
Mm-hmm. Mm-hmm. And the fact that even your cell phone, you can have apps on your phone that help you manage your blood sugars or just like keep track of when you've done things. I remember back when I was little and I had to prick my finger, it would take 45 seconds to get a reading. And if you didn't have enough blood on the strip, you had to redo it all over again. And 45 seconds doesn't sound like a long time when like you're a 7-year-old and you want to go and play outside and you have to like wait. Now it's 5 seconds. Like that in and of itself is amazing.
Yeah.
And now they tell you if there's not enough blood.
Mm-hmm.
So you don't have to redo all of it.
Yeah.
Yeah, that in and of itself. Yeah. So I could talk forever about my experiences with diabetes, but that's not why we're here. What kind of challenges do you face in your role as a nurse?
Yeah, I think the first thing that comes to mind, Emily, is the education aspect of it. I think there's so much education that still needs to be done out there, whether it's with patients themselves or even the healthcare providers, because we can't expect people to manage their diabetes if they don't even understand the disease itself and what's happening inside their bodies, or if they don't have the proper tools needed in order to manage their diabetes. So I think that's huge. Also, access to that technology. I think there's changes that need to be made to allow for more people to gain access to those great devices that are out there.
Mm-hmm. Snaps to that. Well, yeah, totally.
Yeah.
But on the flip side, what are some of your favorite things about being a nurse?
Oh, wow. There's a lot. But I think the thing that I enjoy the most and have enjoyed the most over the years is just really being able to meet and work with some great people. I think people have a story because they're from all different walks of life. People have stories. There's a reason why they're at that point in their life by the time I meet them. And so being able to find out what that story is, make that connection, and then being able to help them get their lives back and to gain control over their diabetes is really a beautiful thing. At the end of the day, it's a very satisfying job. And, you know, again, I mentioned it earlier, but I really do enjoy what I do. And I've actually made some great friends, and we still keep in contact from some of the patients that I've worked with.
That's awesome. And again, that's how you and I got connected. The sites I was using for my insulin pump weren't working. I had built up scar tissue, and you helped me find a new set, and they work amazing. So I was having all these high blood sugars, and I just didn't know why. So, you know, that was, I think, a year ago or more. So
I think so.
yeah, that's how we got connected initially. Um, so we talked a little bit about resources, but if someone was interested in learning more about diabetes or diabetes management, what kind of resources do you suggest they could look at?
Yeah, like you said, there's a ton of resources out there. You just have to know where to look and where you can find them. So I initially refer people back to their healthcare providers initially, because most of them either have internal resources that they can use for patients, like diabetes educators, or they have the ability to refer patients out and send them kind of in the proper direction, or they have proper channels that can be used to, so patients can get that help. And that's so important because there's so many components, and you know this, when it comes to trying to manage your diabetes, you know, whether it's understanding the disease, whether it's, you know, the treatments that are available that are out there. And I always like to tell everybody, be that squeaky wheel, right? Don't take no for an answer. Keep asking those questions until you get the answers that you need, because they're out there.
Wonderful. And we'll include the link to a couple of diabetes associations or groups that are out there, such as the Juvenile Diabetes Research Foundation, or JDRF, or the American Diabetes Association, or the ADA. We'll include those in the event description as well. Beth, I only have one last question for you, and that is, what advice would you give to young women and girls who may be interested in a career in the STEM field?
Go for it. You will not regret it. And again, don't take no for an answer. If somebody says that you can't do it or they don't want you to do it, you just keep going.
Awesome. That's great advice. And I think anyone at any age can hear that, just to go for it.
Absolutely.
Yeah. Well, thank you for joining us today, Beth. And thank you
thank
all
you.
for watching. We'll see you next time.